Aging, a double chin can make you feel less attractive and overweight.
Our next guest joins us now with a way to take care of that double chin. We welcome Dr. Gilly Munavalli with Dermatology Laser and Vein Specialist of the Carolinas. Dr. Gilly, thank you so much for being here.
Thank you. You guys were talking about dancing, and how do you know when you got a double chin? When you make a move this way and the chin goes forward, then you got a problem. So.
You know, I like to say that in my family, double chin is our birthright. So it can be genetic, but what are some other causes of the double chin?
Absolutely. I mean, someone is yourself. You're thin. You're very much in shape, and you still have a small chin. It's genetic for some part, but obviously being overweight doesn't help matters any in some people.
So you got this double chin, and I think most Americans struggle with this. You got this treatment called Kybella. What is it?
Mm-hmm. Well, it's interesting. A lot of our treatments come from nature, right? So this one comes from our own body. It is a solution or a compound that's made up of bile salts, which is exactly what our gallbladder uses when they dissolve. We dissolve fat after a fatty meal. So they took years and years and purified it and figured out if they injected it in fat, it dissolves fat.
Wow. Can we take a look at some of the before and after pictures of Kybella?
Yeah, absolutely.
Okay, let's see what we have here.
Yeah, so we were fortunate, and we've kind of got a head start. We started this trial probably about 2 years ago, so we've treated quite a few patients. And here you can see before and after picture, and this is the frontal view. And you see just that little double chin in the middle, and then here the side view.
Wow.
How it shrinks down. Really, this is someone who is bothered by it. Is this a lot? No, I'd call this mild. But she's still bothered by it. But when you look in the profile, you can see a really nice improvement. And you go to someone here who's even more in shape, and this speaks to your point, Romana, because you don't have to be out of shape to have this problem.
Right.
So she's pretty thin. This is actually one of our patients from the trial, so we're lucky to have our own follow-up. And you can see just in the side view how much more defined her jawline is, and that's an attractive thing nowadays. It's going to be a big buzzword around the neck and all the marketing that goes along with making people look better. This is an easy way to do it.
Now, these pictures are people who are relatively thin. Mm-hmm. Are they the best candidates for Kybella? Are there some people who are better for it than others?
I think it depends. I mean, I think mild to moderate fullness is great. Even a little bit more if you're worried about surgery or anything invasive, this is a thing to do. Now, fullness is to be distinguished from laxity. So if you've got hanging skin itself, when you pinch, there's not much there. That's what for our surgical colleagues to deal with a lower facelift or something. But a lot of people that fit in that category with just a little bit of fullness, like myself, I mean, we don't want it. We can't be out. We don't want surgery. We don't want the scars, and this is a treatment for that.
Okay, so I got a double chin. What are you going to do? You're going to inject me? What are you going to do? What's the actual process? What goes on?
So the process really takes about 25 minutes or so. So we bring you in. We kind of draw out where we need to go. We put a template down that tells us exactly where to inject, and then we numb the area and do the injection. So I did 2 or 3 this morning already. So
how many injections would I need?
It depends on how big so everybody's different. So the bigger the necks, the more injections, and the template will help us to map it out. It might be 10 injection points, it might be 20, but with the numbing, you don't feel anything, really.
Okay, now your office participated in the FDA trials for Kybella.
We did, and that's a good point, because this is a very tested compound. It's got to go through years and years of trials, phase 1, phase 2, phase 3, and the pivotal FDA phase 3 trial we were fortunate to be a part of. And that means that we did 30 patients or so. They went through 2 years of follow-up. And the FDA got the data and said, okay, it's the green light. You can treat.
Yeah, how long is this treatment and can men do
it? Men can do it. In fact, men are a big emphasis because we don't want any scars. We don't have makeup to hide things after a filler or bruising or anything like that. So it's actually a very good treatment for men. And a lot of guys you see working out, they're in great shape, but they still have that fullness. And it's fine for men. It doesn't hurt the beard hair at all. That might be a concern for some people. It doesn't wipe out your beard at all. Beards are in nowadays, so it just complements that, really.
Well, I know there are people who want to learn more, and you're having an open house so that we can. Can you tell us more?
Yeah, we're probably one of the first practices to be doing this already, so we want to make it available. So we're actually going to have an open house tomorrow night from 5 to 7 at our offices, and we're going to do a couple treatments and let people see how easy it is.
And the office is at Randolph Road, 1918 Randolph Road?
Yeah, right across from North Carolina, Randolph Road. Come on in, and we'll have some hors d'oeuvres and can meet our staff and see what the treatment's all about.
All right, Dr. Gilly, no doubt. Well, again, the open house is tomorrow from 5 to 7. The address is 1918 Randolph Road, Suite 550. You'll see a live demo at Kybella. There will be light appetizers, wine and cheese. To reserve your spot, call 704-375-6766. That's 704-375-6766. Walk-ins are welcome too. Or visit online at carolinaskin.com. Thank you very, very much.
Thank you.
No doubt.
My pleasure.
Well, coming up.